Good afternoon. My name is Imran Andrabi. I'm a family physician by background. I'm the President CEO at Mercy St. Vincent's Medical Center in Toledo, Ohio. St. V's is a regional referral center. It's a tertiary level 1 trauma center, a level 3 NICU, level 3 OB. It has a very robust graduate medical education and undergraduate medical education program. Also has 8 critical care units, and it serves 17 counties around Toledo. I, being a family physician, have been with the Mercy system for the last 20 years. And like many other hospitals and systems in the past, we've been looking for that silver bullet. We've been looking for what's out there, the best practices. We brought things in and implemented them, brought in technology. We've had computerized physician order entry for the last 7 years. And then we've sort of scratched our heads and said, why does this all not work? The other thing that we've also tried, and in many times, probably before many other healthcare organizations, was this whole notion of lean and Six Sigma. And again, what we found there was that there was a lot of emphasis on what's happening in individual departments, how do we improve the silos within our healthcare system, and nobody really sort of took a step back and said, what do we need to do to transform the entire organization or the healthcare system as a whole? And so what's different about this, this being the transformation effort that we've gone through with our partners, Care Logistics, is that we've sort of taken a step back and said, how do we improve the capability and the reliability and the outcomes of an organization and not its component parts? This is a very robust human system as well as a robust technology platform that comes alongside it to accelerate the capabilities of the human system. In terms of the specific mechanics, I think it's important to highlight a few things. One is the system has to understand what is it that you are trying to achieve. And for instance, at St. Vincent's, for us, that was a patient's first journey to zero. And the patient's first component is a pretty simple concept to understand, but it's very difficult to execute on, because over the years what has happened in healthcare is people have layered so many different administrative and or other things that come in between the frontline caregivers and the patients that you sort of tend to get away from thinking about the patient and developing a patient-centered processes that give the best patient outcomes. The journey to zero component is the understanding that we have to systematically take out the non-value added work that we do within our organizations. And if by estimates there is about 40 to 45% waste in the system, how do we go about dealing with that waste? So whether that's waste in terms of the rework that is done in the system, whether it's patient safety errors, whether it's quality errors, we need to systematically design processes and methodologies that get us to a point where we have zero defects, zero quality errors, zero safety errors, and get to the best patient outcomes that we're looking for. One of the other things that we did here at St. Vincent's was developing a care coordination system. And that's sort of akin to, if you would think of an air traffic control system, where you have a hub and spoke model. And our hub is basically an area where we have clinical care coordinators who have the ability to simultaneously look at the entire hospital and the workings of the hospital and the patients within it. And then they are in constant contact with our clinical care coordinators who are on the floor 24/7, 365, being able to coordinate the activities and flow of our patients throughout the system. So we are looking at patient flows, we are looking at nursing flows, we are looking at physician flows, and giving real-time feedback to people who are working within the system in terms of their activity, what are they achieving, and where there are potential opportunities to improve. Many people have asked me the question, how does this help? When I look back at what we've done, given what's coming down the pike or is already here in many ways with respect to healthcare reform, us having not done what we've done would have put us way behind the 8 ball in terms of hospital operations and being able to be a robust organization that is able to tackle many of the things that are coming on the horizon, whether it's from a patient safety perspective, whether it's from a quality perspective, or from a financial point of view. From a financial perspective, what I mean is that today you may be in a fee-for-service environment, tomorrow you may be in a bundled payment environment, and in either situation, the system works in such a way that it eliminates waste, eliminates redundancy, takes away the rework that is in the system, and constantly is looking at producing high-value outcomes with the lowest cost that you potentially can provide. So again, from a healthcare reform perspective, doing this on the acute care setting really positions you well, even if you are looking at an accountable care model and developing that entire continuity of care within your system to make sure that your hospital was operating at its peak optimal efficiency to be able to provide the outcomes you're looking for. Not doing this, quite honestly, in my opinion, is not an option. I can't even imagine running this organization in the future without the processes that we have in play today. It's so gratifying to see that when your frontline folks have the ability to understand the data, have the ability to synthesize the data, have the ability to give you insights on what's going on, and have the ability to come up to you and say, this is my action plan, this is my business case, this is what I need you to do, and this is where I need you to get out of my way so I can get this thing done. That's where you feel like you have arrived. So I hope that this information is helpful to you, and if in the future I can be of any help, myself personally or through our partners with Care Logistics, I'll be happy to be available to you. And thank you very much.